Hi, this is Dr. Donald Pelto. Today I want to go over a little bit about ingrown toenails and what you should not use for treatment and kind of the reasons why. Many people come into our office here in Worcester, Massachusetts with ingrown toenails, and here's an example of some of these ingrown toenails. You can see here in number 1 there is an ingrown toenail here on the side. It's a little bit red, so that's a little bit of an infection. It's stuck in the edge, and it's actually created a little bit of extra tissue here. This is called granulation tissue that needs to be taken out and treated. Here's another ingrown toenail here. This little white aspect right here is actually a little pus that needs to be taken care of. This is a very bad one that's infected on both sides, and this patient will likely lose the whole toenail because it's partially detached. This is more of a typical ingrown toenail right on the side. You can see that it's red, it's a little bit swollen, and this is one that's a little bit easier to take care of. In both of these last two, they have a lot of extra tissue on the side. They've delayed a long time with treatment. It's been swollen a long time. These type of ingrown toenails shouldn't be treated at home because they're infected, they're painful, and they'll probably keep coming back. Before you see a doctor, you certainly could try to soak it. You could try to take an antibiotic if your doctor prescribes it, but if it's not getting better, you should go see your doctor, especially if you have diabetes or any other type of circulatory problem in your foot. First example of what not to do. Here you can see a patient took a piece of cotton, put it under the edge of the toenail to try to lift it out. Lifting it out of the edge can work temporarily, but if you're constantly having to lift your toenail out, it's going to be a problem, because usually what happens is on the side of the nail here, you'll develop a lot of callus, because as the nail grows out, it hits the side, produces a callus, and then digs in. By putting this little cotton, you try to lift it up, but it'll keep coming back and it'll keep being a problem. Another example is this little set that has some pads, some special medication to put on the nail edge. This will just soften the edge. You can soften it by soaking it easier. You can use a type of a cream. But once again, if it looks like any of the other ones that you saw, don't use this. And if you have diabetes, don't use this because it can soften it too much and make worse of a problem.